Hello coders! Welcome to Fast Coder 21 free medical coding YouTube channel. Today's session we are going to learn HIV/AIDS ICD-10 CM medical coding decision tree. So in this session we are going to learn how to code HIV screenings and how to code high risk sexual behavior and how to code counseling for the HIV and how to code inconclusive laboratory test and also how to code suspected exposure to HIV. So whenever we code HIV or AIDS, we need to select the reason for the visit or purpose of the visit. If the patient is coming from HIV screening, we need to code. If the patient does not have any symptoms, we need to code Z11.4. So if the patient has signs and symptoms, we need to code the signs and symptoms which the patient have. So if the patient is coming in with HIV related infection, we need to code the diagnosis. For example, you can consider as pneumonia. So if the patient is coming in for screening and with signs and symptoms, we need to code the signs and symptoms, and also we need to code documented high risk behavior using Z72.5. So here second level is if the patient is returned for test results. So if the patient has negative test result, we need to code Z71.7. So if the patient have inconclusive test result, we need to code R75. So if the patient is positive after finding abnormality in the test results, we need to code Z21 asymptomatic, as well as we will call it as positive status, as well as we need to code get 71.7 if counseling is done along with positive results. So here patient is coming for test results. If the patient is has HIV related illness is confirmed, we need to code B20 plus additional codes for the illness currently patient have. And also if the patient has exposure to HIV, we need to code Z20.6 plus additional code for documented high risk behavior using the code Z72.5. So same guidelines we will see in the ICD-10 CM guidelines. Encounters for testing for HIV. So if a patient is being seen to determine his or status, use code Z11.4 encounter for screening for human immunodeficiency virus. So here if the patient is coming for screening, we need to code Z11.4 and we need to code additional codes for the high risk behavior which we have discussed recently. So and also if a patient with signs or symptoms is being seen for HIV testing, we need to code signs and symptoms, and also we need to code counseling if the patient undergoes. And also if the patient has undergone the testing and the patient returns to the informed of his or HIV test results and the test result is negative, as we have discussed, we need to code Z71.7 human immunodeficiency virus counseling. So if the test results is positive, we need to check whether patient is symptomatic, asymptomatic. If the patient is asymptomatic, we need to code Z21 as it denotes HIV status, and if the patient has symptoms related to HIV or AIDS, we need to code B20 along with conditions which are present along with this encounter. Thank you guys. Thanks for watching Fast Coder 21. Please like, learn, comment and share Fast Coder 21.